All right, good afternoon, everyone. Welcome to today's webinar on recovery work. I want to do just a quick check-ins to make sure that you guys can hear me and that the chat box is working. Okay, I'm getting a couple people typing. Great. I've got confirmed responses that people can hear me. Fantastic. Thank you, thank you. Okay. All right. I think we're good then. Now everybody wants to tell me they can hear me. Fantastic. Thank you. Okay, so again, welcome to today's webinar. We are going to be covering the Policies and Procedures Manual for all of the eligible providers who have either already applied to be a designated Recovery Works provider, or for those of you providers out there who are considering applying and just wanted some more information in order to make that decision. So today we're going to cover again the policies and procedures and some details about the Recovery Works program. And again, this is Sarah Kozad. I am the Assistant Deputy Director of Adult Services with the Division of Mental Health and Addiction. And we will go ahead and provide some content today, and then at the end, we will do a question and answer period. This is being recorded, so for future viewing, if people are not able to attend today in person, you can pass this along for, again, anyone who needs to know this information and is not able to join us live today. So without further ado, let's go ahead and get started. So I do want to just remind everybody the purpose of Recovery Works, where the program came from, and again, just why this is all happening. So the background of this program really does go right back to the prevailing need for a partnership between the criminal justice system and the mental health and substance use disorder treatment providers that are out there. What we know is that there is a disproportionate number of people with serious mental illness and addiction disorders who are being incarcerated. We understand that there are, again, disproportionate numbers of people who are being incarcerated in our jails, in our state prisons, as well as those who reoffend, having a higher rate of addiction disorders and serious mental illness. And so the recognition that this is a huge problem for our state that we need to address. We had a fabulous legislative year that came out with the House Enrolled Act 1006, which allowed for funds to specifically be available to support services for those without insurance coverage who are currently involved in the criminal justice system. So this is a special population, and we want to ensure that, again, the reminder is out there that we need a wraparound supportive system where the criminal justice side and the treatment side work together to help this population overcome the serious mental illness and substance use disorders that they're facing, and then the resulting impact it has on their involvement in the criminal justice system. So with that being said, the focus of our funds for 1006 and Recovery Works are on pre-incarceration diversion services as well as post-incarceration reentry services. So what we do want, I noticed that we've got there is audio, and so I'm getting somebody that did not have audio. I apologize for that. The link should be on your computer, audio on the computer. Okay, so again, focus on pre-incarceration diversion services and post-incarceration reentry services. So while we do know that services while people are in the incarcerated setting are necessary, these funds are focusing on the community supportive services for those folks who are out in the community. Now, recovery is in the name of our program. It is a fundamental principle to the work that we're doing, and so I want to speak a little bit about what we mean by recovery. And so SAMHSA, the Substance Abuse and Mental Health Services Administration, has defined recovery as recovery from mental health and or substance use disorders. It is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. So when we talk about recovery, we really want to reinforce that this is a process. This is a process of change. It is not a linear, one way for everybody process. This is something that is going to be very critically individualized to the participants that are referred to you and what recovery means to them. So what we want to ensure is that the persons who are being referred to this program understand what we mean by recovery, and the treatment providers are reinforcing with these participants the fundamental principles of recovery. And so what we are talking about are hope, and that the approach is person-driven, that there are multiple pathways. I'm getting some feedback. I apologize that we're getting crackling and pops. I'm not sure. I apologize. I'm not sure if
Actually, I have to step in here a minute. I'm monitoring as a guest, and the audio quality is just fine. So if you're having audio, it is on your end. Please make sure you have speakers or headphones, and please check your volume. Thank you.
Thank you for that. Okay, so again, we are reinforcing hope. I think that the majority of the feedback we receive from people who are involved in the criminal justice system and who experience the reentry process into the community oftentimes experience this feeling of hopelessness because of the barriers that they are facing when they re-enter the community. And so we need to fundamentally instill hope that there is the possibility of recovery for the persons we are working with. And again, that is person-driven. What does that mean for that individual? That we know there are multiple pathways, that what may work for one person might not work for another, and that we explore the alternative options that are out there in order to support the individual. We are talking about holistic care. We do not just treat a component of we are looking at the person as a whole person, and that we are talking about physical health in addition to the mental health and substance use disorders, in addition to just quality of life. And so that holistic approach is critical. We also know that recovery is supported. It's supported by peers and allies, mutual aid groups, people who have experienced similar barriers and similar challenges related to their substance abuse disorders and or mental illness. It's also supported by natural supports and community, family members and support systems. And so we want to ensure that we are connecting people with positive quality natural supports and mutual aid supports in the community, rather than, again, allowing individuals to approach this recovery process independently without that supportive system. What we want to ensure is that culturally based components are made up into this recovery plan, that we are taking into consideration what it means to be this unique individual, that we do not base anything on assumptions, that we are educating ourselves about the culture of the population we're working with. Critical component of recovery is that it addresses trauma. We know that the majority of folks who are experiencing their substance abuse and mental health issues, in addition to criminal justice experiences, they have trauma histories. I'm not saying everybody, but a large number of these folks, again, another disproportionate number of people who have trauma, and again, untreated trauma we know results in a whole lot of serious issues with mental health and substance use disorders. So again, components of recovery we're focusing on are that it is the foundational kind of process, is that recovery is a reality and that it can be a reality for these participants. And then finally, that our approach is based on respect. And when I think about respect, I definitely want to speak to the fact that the providers need to have respect for our participants, but most importantly, it's that our participants have respect for themselves and that they are treated in such a way that they believe that they deserve the respect that people are giving them, and that they deserve to respect themselves, and to focus on what this recovery looks like for them. And so again, when we think about recovery works, we don't want to just look at mental health treatment or substance use treatment. We want to talk about the person first. Focus on what recovery will look like for them. Again, reinforcing all of these principles from the very beginning, and going along the way and continuing to look at how are we promoting recovery with this participant. The vision for recovery works, we just want to kind of cover our vision and value statements and talk a little bit about, again, what the program is seeking to do. And so the vision of Recovery Works is that every person should have the opportunity to live a healthy, hopeful, fulfilled life in the community. Recovery Works provides community-based interventions that ensure both the safety of the community and the recovery of the individual needing treatment, rather than incarceration. And the key is the partnership in this, that the criminal justice providers are ensuring the safety of the community through their supervisory strategies. And when we talk about the treatment side, we're ensuring the safety of the community and the recovery of the individual, because we're focusing on eliminating the barriers and focusing on safety of the individual and those around them. And we're focused again on that partnership that wraps around and supports this person in the community, rather than in an incarcerated setting. The values of our program: first and foremost, just decency, that all people should be treated with respect and their needs responded to quickly, regardless of the crime that they have committed, the reason they're involved in the criminal justice system. They are a person first, and they deserve the respect that we would give any participant in services. Second value here that I want to talk about is fortitude. We want to instill that people should never give up, and that there is, again, hope, and that we can support that resiliency and that resourcefulness through our treatment services to reinforce that hope for that person, and that they can continue to strive for, again, whatever recovery looks like for them. Hope, I continue to say, when we don't have hope, we have very little to work with. And so hope is a positive future view, something that they can themselves functioning in their community with some alternative to the behaviors that were getting them into trouble, the behaviors that landed them in the criminal justice system. Integrity is another value we want to speak to. We want to ensure that we do the right thing, even when no one is looking, that we as providers know that we have ethical responsibilities to do the right thing by the participants that are referred to us, and that we're in that with the people we work with, that regardless of watching and what the reasons are, that you intrinsically are doing the right thing because you know it's the right thing to do. Parity. We really want to ensure that every person is getting the same opportunity. And we know that people who are involved in the criminal justice system, simply the fact that they have a felony, the participants that we are going to be working with that have a felony on their record, this is just, it sets up some consequences that come just collaterally from the fact that they have a felony. And so we are working with these individuals to try and ensure that they are receiving opportunities, because they have, hopefully at this point, if they're re-entering, they have paid their sentence, and they are now looking to reintegrate into the community, and they deserve those opportunities. And we as treatment providers can assist them in helping to overcome the barriers that oftentimes reinforce that hopelessness of the reality of recovery. So finally, quality. The services that we provide in the Recovery Works program should be of the highest caliber. We want to ensure that, again, treatment providers who sign up to work under the Recovery Works program know what's expected of them, and that it is all outlined for them in the policy and procedures manual, but that services are expected to be evidence-based and of the highest quality. And so again, as you approach the work that you do with our participants, we want to keep in mind recovery and the vision and values of the program. Service ethics. Again, we as treatment providers all have ethical standards which we uphold in our practice. In addition, we just want to review the service ethics for the recovery program specifically. Again, this is all in our manual, but we're just kind of going through the highlights. Effective recovery support and treatment attend to the whole person, not just his or her illness. And again, this is where we're talking about that holistic care. So if you have a service that you provide to address the mental health and or substance use disorder, but there are other things going on, physical health issues, financial barriers, any of these needs that are going on in the consumer's life, we're trying to ensure that we link these persons to the other services that are necessary to treat everything that's going on in their symptomology and needs. And when we talk about this, again, if you're not able to provide that service directly, we'll be talking about who you're partnering with and who you're referring to ensure that the whole person is being treated, not just the specifics of mental health or substance use disorders. Service ethics, again, participants' recovery process is his or her own. And so while these people are oftentimes mandated to come, we again want to ensure that the participants have choice and that they understand that this is their process and they will participate as they want to. And there may be consequences for not participating, but it is ultimately his or her choice. How much they are involved and whether they decide to continue with the program. An individual's recovery plan must be assessed continually and modified regularly to ensure that the plan meets the person's changing needs. We do not want treatment plans, recovery plans that are just scripted, assigned to the participant. We want people to be involved in their recovery process, and so they need to be involved in the development of their plan. This is a collaborative process where we are ensuring that the participant understands what it is they're working on, because it's their goal. It's not our goal that we assign to them. Again, and motivated, and so we will be utilizing the individual's goals and their statements of what they want to achieve. And so we should be modifying this. If goals and needs change, the plan should change to reflect this. To promote what's necessary to maintain services for however long they're needed. What we don't want to do is people in services ongoing without a clear indication of what we're working toward. The goal is rehabilitative in nature. But we also don't want to just cut people out of service at, some arbitrary cap. And so what we will be talking about as we go through the program and the manual is ensuring that services meet the needs of the participant and that recommendations for services are clearly individualized. And then finally, all documentation must be complete and accurate. It's just a matter of ethics that you are writing what you are doing and that you are doing what you are writing. Documentation should not be any different than actual practice. Practice should not be different than documentation. Again, matter of ethics that you are documenting clearly and completely and accurately. Confidentiality, do you want to speak about the specifics related to confidentiality? Participant information is to be kept confidential. This is an obligation for all providers and a legal right for every participant. So Recovery Works providers are expected to comply with confidentiality of the participants' information and protected health and the requirements as set forth in HIPAA 42 CFR Part 2, any other state and federal regulations. This is, again, should be business as usual for providers that you're already following HIPAA standards and 42 CFR. Providers must obtain a complete information from each Recovery Works participant and for each party with whom information is going to be changed. And what we are not doing as the state is setting what that release of information looks like. What we are asking is that each provider and use your current release of information that you already use for your aid. If we do have any questions or concerns about that, we're absolutely willing to help and provide some technical assistance, but we want to go ahead and honor the releases of information that your agency is utilizing. So again, if there are any questions about confidentiality or releases of information, you can let us know, but we expect that what you're already doing is going to meet our standards. Some additional information I want to cover, just again related to the overview of what's expected, is that all facilities in which recovery work services are being provided, we're just asking that you are compliant with all fire, safety, health, and occupational codes. Just again, that you are operating within all the expectations that DMHA certification requires. Agencies must notify Recovery Works Administration staff of any provider changes that happen. So if you have a provider who's no longer going to be providing services, or if you have a new who's going to begin providing services under Recovery Works, we are asking that you notify us within 10 days of that change so that we can get all of the appropriate documentation and make our changes in our system. Agencies agree to make a good faith effort to provide and maintain a drug-free workplace. And finally, you remember that Recovery Works is a funding source of last resort. We've been saying this all along, and I just want to continue to remind folks that agencies are expected to work to refer participants to alternate payer sources. So if somebody could qualify for Medicaid or HIP or private insurance, we are asking that providers are working with them to connect them to the resources. So whether that is somebody in-house that does this supportive work, if that's getting them connected to a navigator to get them enrolled in services, but that is the expectation. The Recovery Works funding source is the payer source of last resort, and that any alternative sources that can cover the person's ongoing treatment, that agencies are looking into those resources. Okay. Speak a little review of some of the expectations of the designated Recovery Works agencies and the providers. This is some information that I've actually covered in a previous webinar on the application process, but I did want to just take a moment to review these points and just ensure that everybody has a clear understanding of the expectations when you say we are going to be a designated Recovery Works agency. So again, by statute, the designated Recovery Works agency must be a currently certified DMHA agency. So again, all of you that have received this notification, it's because you are eligible, because you are a certified DMHA agency. You must apply to become a designated Recovery Works agency and sign an agency agreement. So some of you have already submitted applications, and we are in the process internally of reviewing those. We have some processes, just for your information, to ensure that every agency is a vendor with the state. We are ensuring that you have access to PeopleSoft IDs and all of these internal things so that we can ensure that we are able to pay you. So you will be receiving information from us within this week if you have already applied. If you have not applied yet, applications will be accepted ongoing. And again, when you apply, if you have any questions or need any support, we are absolutely here to help you with that. But once we do get back with you, you'll sign an agency agreement, and then we will be officially ready to get you enrolled in the voucher system and get things going. So again, the agency will include the names and licensure and or education and experience of the individual providers within the agency who will be doing the direct delivery of service. So we have designated Recovery Works agencies, and in that application, you're submitting information about the providers, the individual providers who will be doing the direct service. If an agency does not provide a particular Recovery Works service that is on the application, the expectation is that an agreement will be made with a partnering agency that does provide that service. And so we understand that there are certain providers out there for things such as housing, where DMHA does not certify housing providers per se, but we will allow our DMHA certified designated recovery works providers to partner with other agencies and providers so that we can have the full continuum of services. And so let me speak to that in a little bit more detail. We've been talking about partnering and MOUs, and so I want to kind of explain what we're trying to achieve here. If your agency does not provide one of the services on the agency application, we want you to let us know who you will be partnering with to offer that service. Because again, the importance here is that we have a full continuum of services and supportive care out in the community. So if you are a certified DMHA provider and you don't offer a service such as housing, you're going to let us know who you will be partnering with to offer that housing service. And so we are asking that you do that either in the form of an MOU, Memorandum of Understanding, or a contract, or some type of written formal agreement. We're kind of leaving it open at this point to, again, ensure that this works for people out in the community, and that you are able to start making these partnerships. The key thing we want is for there to be a clear written agreement about things like, what are the services that we are partnering for? What are the expectations of those services? And those services are very clearly outlined in our manual, and so you will state that they will meet these requirements. We also want you to have an agreement about how payment works. And so let me speak to that with this example here. What we are able to do with the Recovery Works funds is to pay for services through certified DMHA providers. And so we will have, for this example, our certified DMHA provider is ABC Recovery Counseling. Okay, so if ABC Recovery Counseling does not provide housing services, Safe Housing does, and they're in their area. What we are allowing to happen is for ABC Recovery Counseling to develop a partnership with XYZ Safe Housing for housing services. So then what will happen is ABC Recovery Counseling will submit claims through Recovery Works, through the voucher system, on XYZ Safe Housing. And then ABC Recovery Counseling will reimburse XYZ Safe Housing. Because again, our state directly to the certified DMHA provider, and the certified DMHA provider may contract with another entity. When you do that contract, when you do that agreement, the MOU, however you're making it, again, in writing a plan, you will clearly be stating that you are going to pay them for the services provided. You will make that determination of how that agreement happens between your agency and your partnering agency, but you will be able to voucher for the payment for those services through Recovery Works. And so, again, this is slightly, had a lot of questions about this, and so if we do have to kind of go through this in the question and answer period, we are taking questions and writing those down as we go. So, but again, the key thing here is that you have an agreement and you are the certified provider who is saying that we are contracting with this partner and we are overseeing the fact that their services are quality services and meet the definitions of the services in the manual. Okay, with that, designated Recovery Works providers. So the agency that is designated as a Recovery Works agency can then have individual service providers working within the agency who will become designated service providers. The designated service providers are expected to practice within their scope of their individual license and or their educational level, and we are determining this based on IPLA standards. So if there are questions about whether I am a licensed professional or a physician or a QBHP or an OBHP, we have outlined this information in the manual. We have taken this from IPLA, and we have been addressing ongoing questions just as they come in, but please do contact IPLA if you're having any questions or concerns about what it is that you're able to do with your license and or educational level. But we are outlining people under the kind of MRO standards of licensed professionals and physicians, qualified behavioral health QBHPs, and other behavioral health providers, OBHPs. In the service sections, you will see a section that says who may claim for this service. And so we have outlined under each section what provider level and designation is able to bill for those services. For the individual providers, we've been mentioning that there are going to be some required trainings that must occur in order for providers to bill and treat the participants who are referred. So the first training here is a DMHA online training, and that is what you are experiencing right now, the policies and procedures training. So we are asking that if you are participated today or you become a provider, that you will experience this 1-hour webinar and that you have all of the information that we cover today. We have a DARMA training. So DARMA is the Data Assessment Registry for Mental Health and Addictions. A required step in order to be a provider and to use the vouchering system. We did send 2 webinar reminders for DARMA. The DARMA webinar for CMHCs, Community Mental Health Centers, you should have received one, and then everyone who is not a CMHC, all the other providers are receiving a DARMA training request. And so if you did not get a DARMA training request, please let us know, because that is supposed to occur this Wednesday. And so you should have received this last week to block your schedule for a 1-hour training Wednesday morning, depending on your provider type. We also are going to have a WITS training, and I'm going to speak about the WITS training in a moment here, but that is something that will again have to occur so that you can use the vouchering system. DMHA online trainings, recovery model, and working with the justice involved, those will be forthcoming. Personal safety or nonviolent crisis intervention training, that again we've talked about that your agencies likely already have a requirement, and so we're asking that you demonstrate that your providers have gone through some type of personal safety training or nonviolent crisis intervention training. Motivational interviewing specific to the forensic population, we will be taking some existing trainings, and we will also be offering face-to-face training specific to this population. And we'll talk ongoing whether or not, if you already currently have motivational interviewing training, if that's going to meet the standard, but we will provide information on that in the future. And then finally, ANSA certification training. We are allowing the recovery model training on down. Recovery model, working with the justice involved, the nonviolent crisis intervention, motivational interviewing, and ANSA certification trainings. These must be completed by June 30th of 2016. So we are giving people a little bit of flexibility to get these trainings completed so that you can go ahead and start providing services now, knowing that you will meet these training expectations by the deadline of June 30th in order to continue providing services under the Recovery Works program. And again, training information will be forthcoming, and we will ensure that you have a clear opportunity to get these trainings completed within the time frame, and that we will have regional options and things for easily accessible options for training. So again, the training today is the policies and procedures training, and so the majority of the kind of first steps are already occurring, and you will have already completed those. The WITS training, I wanted to speak about this just on its own. We've been talking about our voucher management system, and WITS, the Web Infrastructure for Treatment Services, is our voucher management system. We have been working very, very diligently to get this system up and running so that it can communicate with DARMA, which is something that has not happened in the past, and it is something that's actually caused a little bit of a time stall here on getting the WITS vouchering system up and running. So what we want to ensure is that people understand we are going to be utilizing WITS, but we are not going to be starting the WITS component of this program until after the new year. So we will roll out WITS and the voucher management system fully on January 1st. But what we are going to be doing is providing voucher reimbursement as of November 2nd. So we are moving forward with the November 2nd rollout. The WITS component will come in January. And so we will talk about that WITS training component over probably the month of December to ensure that everybody has access and understands how to use the system. So when you're thinking about who needs access and what type of training will occur, there are 4 types of access to WITS. Again, the web infrastructure for treatment services. So the rendering provider, this is somebody who provides services. They're in the system by name only. They don't have access to WITS and they don't require training. We also have folks who maybe read only. They can read what's happening in the system, but they can't manipulate anything and they don't require any training. They can just see what's happening. Then we have 2 other types that will require training, the data entry and the release to billing. So persons who have access to the system to input participant data and billing encounters, this person is going to require training because they're going to be the ones who are doing the data entry and claiming through the WITS system. People who have release to billing access, they have all the above capabilities and can release vouchers to bill. So data entry is one component and then releasing it to bill is another. It may be the same person in your agency, and so we will be, again, providing support if you're needing some more guidance about what provider type and access type you're going to need. But again, not everybody has to be trained in WITS. It just depends on how your agency is going to do it. I know that there are some people who have billing departments who will do this, and they'll need training, and the rendering provider just needs to be able to input things, or data entry provider. So again, we will ensure that you get the WITS training component, but that will come in December so that we can roll that out January 1st. So when we think about just kind of, again, what is expected of a provider, I want to ensure that everybody understands that there are certain expectations that we've set when you say that we are going to accept referrals for the Recovery Works program. And so I just want to cover these again. This was in the application webinar. So again, some information that we've covered before, but I do just want to, again, ensure that everybody understands what the expectation is. So the new participant procedure will start with the criminal justice provider. The criminal justice provider will assess that the participant meets the eligibility requirements, and they will select the provider in their area who has been a designated Recovery Works treatment provider. So when you accept a referral, you are expected to contact the referred participant within 2 business days of that referral to schedule an assessment. The criminal justice provider is in agreement that they will provide required documentation with the referral to inform and facilitate the assessment. So we're asking the criminal justice provider to offer things like the IRAS, the individual risk assessment, any documentation from the court that says anything that will be helpful to inform why this person needs treatment and what their involvement in the criminal justice system has looked like. We've explained to the criminal justice providers that the treatment provider will not assess the referred participant until they've received some pretty supporting, clear documentation of why this referral is coming their way. So the referral form will not be sufficient. The referral form will be one component, and the criminal justice provider will offer additional paperwork and supporting documentation to support and inform the assessment. The treatment provider will offer an appointment to the participant within 5 business days of receiving the referral. We know that if you're not able to contact the referred participant or they're not responsive, that might not be possible, but that you are offering the appointment within 5 business days of the referral, and that you're documenting that outreach. You will notify the criminal justice provider regarding the outcome of the outreach contact. So if that is, we've got it scheduled and it's on this date, fantastic. If it is, I've attempted to contact my participant 4 times on these dates and they're not responding, that's, again, another critical piece of information that you'll need to provide to the criminal justice referring person. Some additional expectations for the new participant procedure. The provider is going to obtain all necessary participant consents and releases of information. The participant is going to have the very first service with the treatment provider. It will be the complete comprehensive mental health and substance use disorder assessment. And we'll talk about that in the service section. But this is the starting point. The first service must be the comprehensive mental health and substance use disorder assessment. That starts the process of the assessment and then the completion of the individualized recovery plan and the referral to any required services. One component that we are expecting, again, of any provider who is currently certified in ANSA, that you will complete an ANSA from day one. I have an asterisk here because this is one of those training components that we have stated you have until June 30th of 2016 to become ANSA certified. So if you are currently ANSA certified, you will complete the ANSA certification, the ANSA assessment as a part of your comprehensive mental health and substance use disorder assessment. If you are not currently ANSA certified, you will do the comprehensive mental health and substance use disorder assessment without the ANSA, and we will have a different billing rate for those two. To, again, kind of focus on what the new participant procedure looks like and what those expectations are, just to kind of recap here, your starting point of accepting the referral is making the outreach, getting them in for an intake assessment, that you are offering that as soon as possible, but no more than 5 days out from the referral. Ideally, these people could use same-day access if you have that capability in your center, in your agency. When these folks are ready, we want to get them going and get them engaged. And you have up until 5 days to get them in. You will complete assessment, and then you will guide the participant through the development of an individualized recovery plan, and you will share that with the criminal justice provider. You will be engaging this participant. You will be collaborating with all the members of the treatment team, anyone to whom you refer. You're going to be communicating with the criminal justice provider, and we want that communication to occur frequently. This is a population, again, who needs support, and they need their providers and their referring people all on the same page in a helpful and supportive way. So you are, as the provider, going to be providing the services based on the IRP, the Individualized Recovery Plan. If you're unable, again, to provide the recommended services in the Individualized Recovery Plan, we're asking that you partner with another agency. We want to ensure that the participants have access to the full continuum of services. You're also expected to maintain an ongoing record of all contact and attempted contacts. And so we're asking that you have some pretty clear things in your client record. So the participant record requirements. When you have a participant involved in the Recovery Works program, we are asking that your treatment record has a completed Recovery Works referral form in it. Again, this is the kind of starting point that ensures that the criminal justice provider has determined they meet eligibility requirements and that they are referring them to your services. You will keep in here also the pertinent criminal justice documents, so those forms and documents that the criminal justice provider sends along with the referral, that you have that in the record as well. That you have the participant's biopsychosocial assessment and answer results, that you have a completed individual recovery plan with any updates as appropriate. Again, that plan should be ongoing and change as needs change and as functioning improves. completed individualized recovery plan, again, this is a form that we have created for you. If you have your own treatment planning process and all of that, ideally, you will have a record of that as well, but the individualized recovery plan specific to Recovery Works is required. Completed releases of information forms. So again, any forms that for releases of information that you use at your agency will be accepted, just ensuring that there is a completed release of information for any party with whom you are going to be communicating or exchanging information. Supporting documentation for all billing claims. Again, the expectation is that you will have a written record that documents the services you provided, and that you will have that for all billing claims that you submit. We will not require that you turn documentation in with the claim. We just expect that you have it maintained in the participant record, and when we audit, we will be able to verify that. And then finally, information in the client record can be digital or paper. Again, we are trying to support the work that you are already doing and not ask providers to completely reinvent the wheel. So we are asking again that you keep your records as you just typically do, whether that is electronic or paper records. Okay. Now, Recovery Works services. Everybody, I'm sure, is very excited to hear about the specifics of this. I did want to just point out that in the meeting invitation you received last week, there was an attachment. I'm a little fearful that maybe not everybody opened the email and saw that attachment. I got a lot of feedback that people wanted to see the services. There is an attachment, again, in the meeting invite that you received, and it does have the draft of the provider qualifications and expectations, a draft also of the services. And when I say a draft, it is because we are currently still working to add some additional services and get some pricing determined for those services. And so we'll talk about some of that in a few moments. But I did want to just remind everybody that if you open up your meeting invitation, you should see an attachment, and that has a very nice list of the services, the provider qualifications, and the reimbursement rates in kind of a chart format. So without further ado, let's talk about Recovery Works services. This first piece that I want to speak about with the services is that there are some services which will require a prior authorization. Okay. So prior authorization, we do not want to make this super complicated. We just want to ensure that everybody understands there are certain certain services that will need a prior auth at different points. And so I just want to kind of point out that this is a snapshot of the form. The form is, again, pretty simple and straightforward. You will put your designated agency name, the date, the provider who is requesting the services, the unique identification number of the participant, that should be the DARMA number, and then the type of prior authorization. Is this just a prior auth service that it has to have a prior auth, such as inpatient detoxification? Is this a participant cap increase, such as medication that is exceeding the $500 maximum? Or is this a special request, something such as medication-assisted treatment, ongoing, or some other thing that we probably just haven't thought about yet but we know will happen? And so we've allowed kind of this special request other category just for things that we might not be able to kind of foresee right now. So with the prior authorization checkboxes that you're going to state, this is a prior auth, this is where we're at, we're asking that you provide some narrative information about this participant and the prior auth that's requested. And we've given kind of some bullets of questions to consider, and then there's a narrative section where you can fill in the blanks. What I want to just remind people is the more detailed you can be about what it is that you're trying to accomplish, the better off we will all be in trying to authorize that prior authorization. So if you aren't able to meet the very specifics of these questions, please, provide the most information you can that helps us understand the situation and why this prior authorization is necessary to support this person's recovery. So with the prior authorization forms, It'll be, again, a simple process where you can complete this and submit to the Recovery Works website, or I apologize, the Recovery Works email, and we'll get you that contact information toward the end. So prior authorization, again, just did want to speak to that some of them must be prior auth before, some at different points in the process. And those are all very clearly detailed in the service definition section as well. Okay, so let me just introduce you to the alphabetical listing of the Recovery Work services which we are covering. I do want to kind of breeze through this pretty quickly, simply because you'll have access to this in that document, and because I want to offer opportunities for some question and answer, and we're nearing the end of our time. So I do want to just kind of breeze through and let you know that alcohol and other drug screenings will be covered. This is very critical that you understand this is a clinically indicated service, and that we will be asking that you demonstrate that this is a clinical need, not a requirement simply of supervision. Very different. This will be a $15 reimbursement per screen. Answer redetermination, we spoke about this earlier, that if you are doing the ANSA because you are currently certified, the initial ANSA will happen in the intake, and then any redeterminations can be billed if you are not billing Medicaid. So if you are a Medicaid provider, you'll just do your ANSA redetermination through Medicaid like you do everything else. But if you're a non-Medicaid provider who becomes ANSA certified, you can bill for a redetermination. Case management, these, again, services are pretty much verbatim from Medicaid standards, and so case management services does not include direct delivery of medical, clinical, or other direct services. This is management of the case. So the services that you are doing to ensure that the participant gains access to the necessary services and that they're linked to the appropriate services and that you are comprehensively treating this person, those are case management activities. You're managing the case. Moving on, the comprehensive mental health and substance use disorder assessment. Again, I do want to remind you all that this is the first stage of treatment within the Recovery Works program. This must include a diagnosis, clear medical necessity for ongoing treatment, and the participant's statement of his or her individualized treatment goal. So the ANSA must be paired with this assessment if you are ANSA certified. If not, then you'll bill the $75 assessment without the ANSA. This is a licensed professional or a QBHP who completes this comprehensive assessment. Healthcare coordination services. This is services specifically to build individual and community capacity related to healthcare. Community health workers and or certified recovery specialists are the providers who can bill for this. Housing assistance, we are doing supportive housing assistance at a $25 a day. There are some really detailed specifications about what housing requirements must be met. And so again, this will be clearly identified and listed in your full manual. Inpatient detoxification services, this service will require prior authorization. Detox services will be based on individual need and diagnosis, and this is going to be the full medical access to inpatient detox. So a service provided must be in a setting that is 24-hour a day, 7-day a week, 365 days a year with medical access. We will be billing this at a $220 bed day. And we also, I just want to speak to kind of the residential component, not full inpatient detox, but residential. This has been a service that we have heard many people say we need to cover. We are looking to cover this service. We are finalizing definitions and reimbursement rates for this right now, but that will be forthcoming. So I do want to let people know that we are developing currently a kind of a residential treatment rate as maybe a titration step down from inpatient detoxification. But we do not have that in our service definition list yet, but it is coming. Treatment, so your basic IoT services, 3 hours a day, at least 3 days a week. We will be reimbursing at your standard IoT rate based off of Medicaid. Medication assisted treatment, we are doing this in the form of opioid treatment prevention bundles. And anybody who's doing medication assisted treatment bundles, they must be recognized by DMHA to provide this service. And again, there are some really clear details of what is included in a bundle and the payment rates for that in our service standards. Again, rather than going into all the details of the bundle rates, I do want to just speak to the fact that beyond the initial intake and an additional 10 days of dosing and services will then authorization. So what we want to ensure is that people can get into the OTP and get services started, that they can get the initial intake and 10 days of services and dosing, but that you are working on a prior authorization for anything beyond that time frame, so that we can continue to assess how this person is going to move away from Recovery Works funding for ongoing OTP medication assistance and toward other payer sources that will sustain their ongoing treatment. Medication of mental health and or substance use disorders, we are going to be covering medications. We have set a cap for $500 at this point, and again, we will look at anything above that $500 rate, and we will do a prior authorization process for that. So reimbursement for prescription medications will be a little unique in that we will do 1 unit equals $1, and so when you claim for that, the total number of units will equal the actual pharmacy price. So if the price of the meds was $65, you will submit for 65 units for that medication. We are requiring that you keep receipts so that you have record of that, again, for audit. Mental health counseling services, again, counseling services at the rate for individual, group, and then family rates. We have peer recovery services that are going to be covered. Certified recovery specialists or certified recovery coaches, either through Aspen or ICATA certification, are going to be accepted to provide peer recovery services for Recovery Works. Psychiatric evaluation and medication reviews will reimburse. Again, basic definitions will be covered in our service manual. Skills training and development services will be covered. Substance use disorder counseling, again, also covered. Supported employment services, so concentrated placement support and ongoing services that are going to help maintain employer and community relationships. So those unique services related to hiring and interviewing and how to present appropriately in those interactions, that can be billed under supported employment services. A lot of things can also be billed under skills training and development if it's not specifically employment related. Transportation services will also be covered, transportation to and from recovery-related activities in the form of the most appropriate and cost-effective manner. We're saying if you are going to transport them in an agency vehicle, we are billing at the 40-cent a mile rate, which is the new state rate. Public transportation, similar to medication, we're doing it at a 1 unit equals $1 actual cost. Again, receipts will be requested for audit. So again, if you're buying bus passes and the bus pass was $25, then you'll enter 25 units. Okay. Finally, we are running short on time here. Voucher reimbursement. I mentioned earlier that we are going to be doing a little kind of interim process. Second, next Monday, we will begin the process of paying for services and accepting claims. The issue is that our WITS voucher management system is not going to be ready to communicate with Dharma until January 1st. And so what we're doing in the interim is allowing for a paper billing process. And so I do want to just remind everybody that we need to get services going, and we did want to make sure that we met our November 2nd date. Internal workaround. This should not be any extra work for all of you, just minus a different process. But this should not be any extra work or duplicative work for you. It just is a kind of workaround process that we're going to house internally here. So the key thing that you're going to understand is that you get the reimbursement for the service from from November 2nd through December 31st. You are going to submit a voucher reimbursement weekly billing claim. Okay, so weekly until we roll over into our WITS voucher management system as of January 1st. Then we'll start to do a 3 business day service claim in the WITS system. But again, you'll get additional training on that. But the key things that you're going to have in this voucher reimbursement form are just listed here. The participant ID, their Dharma ID, their date of birth. So we just have a verifying checkpoint. The date for which you're claiming vouchers, and then the services that you provided along with some key pieces of information. You can either fill this in electronically and then print and sign it and scan it back to us, and print it out, fill it in writing, and then fax it back to us. Again, I do want to request that if you are filling it out in writing, write legibly. We don't have any misunderstanding about what you're vouchering for. This next slide here is the voucher form that you to complete and submit. It has all of those key pieces of information clearly outlined for you: the service, the date, the start and end time of the service, the number of units based on the service rates, and then the note. And the encounter note is only necessary if the service was provided by one of your partners, one of your contracted providers. And that's all the encounter note will require, is that who the rendering provider was that offered the service. So, my goodness, it is 2 o'clock already, and so I do want to offer the opportunity to answer some questions. I've had Sarah, my support here, writing things down and addressing things as we go, and so I do want to take a few moments to address some of these questions. So, Sarah, can you help me out? I know you've been typing people's and letting them know as we go.
Okay. These have not been answered.
Okay.
Everybody that has asked for the save the date for the Dharma training is on a list.
Great.
So that has all been taken care of. These are the questions.
Okay, fantastic. So let's go through here. So I did get a question about manual says client screen for any substance they report using. Joint Commission accredited organizations can only use waived test, and there's no waived drug screens for Q, for example. Fantastic question. Probably seeking some feedback from providers out there who have any that are waived for K2 and things. I'm sure that there are going to be some unique circumstances where there are substances for which we don't have a 6-panel screen, and so we can kind of look into individual basis. The question I have is, what if the participant qualifies for a funding source that indicates they're also a last resort funding? Gambling funds, who do we bill first? Fantastic question. So I think the key is that if they have any other payer source, such as Medicaid or HIPAA, that they're going to a provider who will cover that. If the services are specific to gambling, then I would say you're billing gambling. If it's more specific to the fact that they're involved in the criminal justice system and that we're treating the specific mental health and substance use disorder related to that, I would say recovery works. But again, those are unique questions, and I would go with just ask us kind of as those questions come up, and we can address those on an individualized basis. Question of where is the draft of the manual? So it has not been released yet. This is, again, we're winding down to the out as of next week. We will have that up and go by that point. And so it's going through our kind of final draft process. What's the time frame for approving applications? We are working on approving applications currently. There are a couple just state required things, like making sure you all have a vendor ID with the state and that you have PeopleSoft, and so we'll be getting those back to you. Also, ideally this week, as far as anybody who's currently applied, and then we're turning them around as quickly as we can, because we, again, want to get you guys up and running so you can provide services. But as far as the timeline, I don't have a beautiful answer for you. We're doing it as we go. Another question, if someone qualifies for HIP state plan, can't receive MRO services, how will that work? Will you continue to cover services until the client gets HIP state plan? So the goal here is that a service is covered under HIP, then HIP covers it. But if HIP does not cover service or Medicaid does not cover this MRO, then the reimbursement for our funds can cover that. So example I keep using is if they have MRO or HIP and HIP only covers clinic and they need skills training, well then you can use the Recovery Works funds to cover skills training. If they have an MRO but that does not cover transportation, all the other MRO services, then you could use Recovery Works to cover transportation. So it's that kind of gap fill service. Couple more here. When will MOUs officially have to be in place? Can they be signed after applying for the contract, or does it need to be prior to applying? So we are saying that when you apply, you will put your partner down on the list. We are not requiring anything official until you start actually vouchering for those services. But the kind of key thing is that you have a written agreement in place with that partner before you start to services for which they're paying, because we can't pay you for services and we can't pay other people for services until we have those kinds of standard things in writing that this is what the agreement is. And so that's kind of our key, is before vouchering for those services, before those services start occurring, that you'll have that written agreement into DMHA. Couple more. Oh, so all the rest of Dharma training. Oh, okay, so if someone is trained for problem gambling, will they need to be retrained in WITS? This is why we're kind of doing the separate training. If you've already had exposure to WITS, there will be just some kind of minor tweaks, because first time that WITS communicate Dharma. And so this is a new that's happening with WITS, and so you'll need a little bit of training. It might not be as full and comprehensive as somebody who's never been exposed to WITS before, but it is really because Dharma will push information to WITS, and so we just want you all to understand how that's all going to work. A couple more questions. How is it decided which services are provided in the community versus clinic-based? We're looking to you as the treatment provider to determine what's most effective for the person. So we're billing the same rate, whether it's counseling in the office or counseling in the community home-based. Same thing with skills training. If it's skills training in the community versus in the home versus in the office, we're billing the same rate. We're just looking at you as the provider to think about what's most clinically appropriate. Is it community-based services or clinic-based services? For clarification, regardless of the care plan utilized by the agency, an additional recovery plan specific for Recovery Works is required. Yes, that is the clarification. So however you do your treatment planning, you'll do that, but there's this one just special individualized recovery plan. It is not really lengthy or comprehensive. It is just a clear agreement that you're going to then provide to the criminal justice provider. So there is that special individualized recovery plan. What will the time frame be for approving prior auths, inpatient detox if needed? So we were having this conversation that prior authorizations, we will make those a priority. Ideally, if they are during business hours, we will try to turn those around within a 24-hour period. If it is an emergency, like inpatient detoxification services, we're just asking that people give us a heads up and communicate with us and let us know. We want to expedite the process as much as possible. We don't want things to get stuck in a queue of paperwork and then prevent people from getting services. So what we're asking is that those unique circumstances, if this is we must have them in today and we need this prior auth right now, that you'll let us know. Obviously, we are only open during government business hours, and so if it is a weekend, we're going to have some things that we're probably going to need to troubleshoot and work around, and we're open to kind of discuss those scenarios. I've received some questions from providers that have given me some really good scenarios to think about, and so we'll continue to assess that. But the goal is that we will be turning prior auths around very quickly because we know that it is medically necessary. A couple more. Previously told telemed and telebehavioral will not be covered. Is that correct for therapy and med services? At this, definitions do not include telehealth and telemed services. That is not to say that that won't be something that we can cover in the future. We're really trying to kind of get the baseline out there of what was statutorily required, and then we're discussing services to add for year 2 as we kind of see how things go. And so telehealth, telemed, those services are on our radar, but at this point it's covered in our definition. A couple more here. If there is no partner to provide a service listed in our community, how do we respond since we cannot provide an MOU? What we're asking is that if there truly is no provider for that service in your area, that you provide us that information. We know there are limited abilities of detox services in our state. We understand that some services are minimal, and so this is your opportunity to tell us we've exhausted all effort to find a partner and services are not available in our area. And if you let us know that, then we can check that data. It will be helpful for us as we're kind of assessing where we go. Is relapse prevention group, MRT group, or modified IOP group, which are all 2 hours to be covered. So if you're using these as substance use counseling groups, if they're 2 hours, I would say that would fall under substance use counseling rather than a full IOT, because IOT has to be 3 hours. But I would say yes, that if those fall under substance use counseling, in my opinion, unless I saw your and could give you a more specific answer, I would say those would be substance use counseling groups. Keep them coming. Will we be able to in this program participants that we already have in treatment and we know they are otherwise eligible for this funding, or do we need to be newly referred by a criminal justice provider? I would say talk with your criminal justice provider. They do have to be the ones to make the referral. I don't know that they necessarily have to be brand new to treatment, but they do need to be referred by the criminal justice provider. So I would speak with them and talk with them about whether or not they think that they are eligible. Will the 3-day billing requirement also be in place for contracted services? Okay, so yeah, what we would say is that you'll work that out in your agreement, how quickly they need to bill to you so that you can get it into the system. So I say that the contracted providers should be billing you daily maybe, or at least every 2 days, so that you have the ability to get that into the system. But again, I'll work that out. Was Medicaid receive services by Medicaid, and so I did that again. Medicaid doesn't cover the service, and it's covered by Recovery Works. You can claim for those services. How do we bill for the MRO match? Is there a service category for batterers intervention? 2 questions. Medicaid match, we are going to do that internally, and actually when we speak to our CMHCs, we will be giving you some education about the MRO match process. We're going to do all of that kind of in-house so that you don't have to mess with it. So we're excited to offer you that as a hopefully nice process to get the Medicaid match paid, because we will be covering the match for you. And then, is there a service category for batterers intervention? This is a service that we are looking at for year 2. We have gotten lots of feedback about it, but at this point, we are not covering the BIP. But year 2, possibly. Is there any place for people with bachelor's degrees to work in this program? Absolutely. So bachelor's degrees those are our other behavioral health providers. So rather than going through all of that, please do take a look at the attachment of what your associate's degrees and bachelor's degrees as other behavioral health providers, what you're able to bill for. Do you identify participants? I'm not sure what that question means, but the eligibility requirements for who can be a referred participant, that's the criminal justice side. So if that's what the question is, hopefully I've answered it. If the agency does not take HIPAA or Medicaid or MRO, is the client has that level of insurance, the provider is responsible for referring to an agency that does not take that insurance. So here's what we have explained is if they have Medicaid or insurance and they choose not to go to a provider who covers Medicaid or insurance, then they have they're going to have to pay for the service. So it's just as if I choose to go to an out-of-network provider for my insurance, I can do that, but I'm going to pay out of pocket. And so that's exactly what we're talking about. So if they are going to receive service coverage and they have Medicaid, they need to go to a provider who bills for Medicaid, or they can pay for it. Couple more here. What housing entities qualify as offering housing assistance? So that's a pretty complicated question. I will ask you to look at the definition, and then if you have questions, get with me after the fact. I think that would be easier. When and where will voucher forms be? So we will have actually this final piece here. Contact information. We do now have a general email box to answer all of your questions. So the recovery.works@fssa.in.gov. I do want to speak to that. And then we will have our website up and running this week. The website, you will be able to access all of your forms and the provider information for any designated approved designated Recovery Works agencies, and then all of the resources and links and webinars will all be posted onto the website, so you will get information from me as soon as that's up and running, and so you'll be able to get the voucher forms and everything you need from there. Downloading slides for this session, I will send slides out for everybody with a link to the webinar recording. And can we bill for other psychotropic meds besides MAT? Absolutely. That's under medications. And then are criminal justice folks also receiving training? They absolutely are. We have done a training over webinar, and so if people want the link to that, I can provide that to you. You can let me know. And then we're also doing just speaking engagements across the state for lots of people who have been asking us to come and speak to their criminal justice providers. So we are doing that. And then finally, it looks like we have, two more, sorry. And then we're going to have to shut this down. Sorry, guys. Are funds available through this program the same as money available through DOC? This is a different process. So the DOC received funding to offer grants to counties that collaborate together on a plan. They're focusing on those grants, and then we are focusing on treatment vouchers. And so the funding are different, and they're going to be distributed differently. So that's the kind of key difference, is that DOC is doing grants, focusing on kind of increasing supervision and diversionary programs, and we're focusing our funds on treatment. Anger management was another one that we are looking at for year 2, similar to batters services and those pieces. So we're looking at that as potential funding, but those are not covered this year. I believe we've got...
He was asking about his specific place.
Oh, okay. And so we can talk about that. So with all of this being said, I thank you all so much for your attention. I apologize that we went over, but you had fantastic questions, and I did want to ensure that I got through all of those. Please do not hesitate to get in touch with us if you have additional questions. Again, the recovery.works@fssa.in.gov email that I have listed on this slide is going to be your best bet, because then we have our team of folks who can respond to those questions and field all of the comments and things that are coming our way. So we are very excited about this opportunity, and we thank you so much for your time and your attention to this. We are really looking forward to Recovery Works being a fantastic resource for many, many people out there. And again, if you have questions, if you have comments, please do let us know. And I will be providing the links to the webinar and the PowerPoint slides. And as soon as the website comes out, you will be getting this information. I do want to remind everybody that, again, there was that attachment in your meeting invite today that has a lot of this detailed in an easier kind of printout version that you can then ask me questions if you have them after you review it. So thank you all so much, and have a fantastic rest of your Monday and a great week. And as of next Monday, we will be up and running Recovery Works on November 2nd. So thank you all so much, and have a fantastic day.